Hey Fred, all right, we got some questions here from our Facebook and internet world here, and the first one is from Rob, and he asks about DMSO. He's got some extensive joint pain, some foul surgery that he's had in his past, and he wants to know, he had heard from somebody else that rubbing DMSO on the joint area would decrease the pain. Can you offer any comments on that as well as any other lifestyle suggestions, please?
Well, I first heard of DMSO maybe about 50 years ago. I had a friend of mine that was a horse trainer, and he had Paget's disease, and I saw him. He used to rub it on his legs a lot, and I asked him what he was doing, and he told me it was something they used on the horses, and it was DMSO, and he said it worked very, very well. The only thing I noticed about it is that he always smelled like he just ate a lot of garlic or rubbed garlic on his skin. And I got got interested in it, and I saw that the research showed that it had many, many benefits, and it was very, very controversial. There had been a study where it, in extremely large amount, it could have had a detrimental side effect within the lens of your eye, but follow-up studies showed that used in anywhere close to recommended amounts, there was really no side effects to speak of. The only side effects was, a garlicky smell that would come from your breath and from your skin, and it could, in rare cases, cause a skin rash, but there's never been any documented side effects that could really be a problem. In fact, I had often thought about it, if some of the medical drugs that were on the market today, if you just watch television, you look at the side effects, if they were held up to the same scrutiny as DMSO, a lot of these drugs, they wouldn't be on the market. So there's no money in DMSO, the way I look at it, and you have to be careful if you do decide to use it on your own. You got to make sure you're using pharmaceutical grade. There are some doctors that recommend it, and pharmaceutical grade, as far as I know, is only available by prescription. You don't want to use industrial grade. That has some byproducts in it, and you got to be very careful. You do use. You got to make sure your hands are clean. It is a solvent. It was used to preserve organs that were being preserved for transplant, so I can't see how it could be too harmful. And it was used in paint thinners as a solvent, so if your hands are dirty, it will carry whatever into your hands, it's hydrocyanic into your skin. So try to get advice from your doctor about it, but I've seen some people get some very good results with it. Never used it myself. Have seen people use it, and never heard any complaints about it. It works as a medicine. It's not a cure. It will help relieve symptoms.
Great, thank you, Fred. And a follow-up question from Wendy, who you had answered the previous Q&A vlogs, that she said, I watched and I listened, and I heard what you had to say about poor circulation in my hands, and I do believe that what you said about my calorie intake is very important. She's 31 years old, female in Pennsylvania, exercises 4 times a week. She did have a thorough exam in the past few months, including a thyroid check, and all levels came back normal. But her question is I never learned how to know how many calories that I should be taking in versus how much I'm burning, but I do worry about overeating, so I probably cut my calorie intake too much as a result. Is there a way to figure out how much I should be eating and to follow the intermediate level lifestyle?
Well, that's kind of a difficult question to answer, because no two people are the same, and everybody's metabolism is totally different. I can just tell you it myself. I get just as much energy on half the calories I ate that I used to consume when I first went on a raw food type of a diet. So as your body becomes more biologically efficient, you actually need less calories. And sometimes the reason a person's cold is they're not exercising enough, they're not getting any radiant heat from anything, they're not even consuming any warm water. But if you're exercising and your body weight is staying stable, you're probably getting enough calories. If your body weight's coming down and and you are exercising and you feel cold, try adding a little more fats into your diet or a little more of a concentrated food to give you more calories. But it's not really necessarily the calories, it's the resistance that the food is creating. When your body has to work harder, it's like exercising. The resistance that the food is creating is going to make you warmer. So I think one of the biggest problems amongst vegetarians and raw fooders and people eating good diets is the confusion about protein. People do try to convince them that you have to have animal protein and get a lot of protein to be healthy, which has been proven a long time ago that it's nonsense. And the other part about calories, that you have to be getting a certain amount of calories in order for you to maintain your body weight and do all the things that caloric intake is supposed to do. Everybody's a unique individual, so try to make some adjustments. If you think you're not getting enough calories, just add a little more concentrated food into your diet and see how you feel. But if you're not symptomatic, you feel good, you're not losing weight, everything else is fine, and somebody's trying to convince you you're not getting enough calories. Now, there's a number of different reasons why your hands could be cold in cold weather, but it might not necessarily mean that you're not getting enough calories. When you're in cold weather, it's a good idea to take warm baths once in a while. It's easy to keep your body warm. You might need a little bit extra clothing. If you've been evaluated by a doctor, they can't find anything wrong with you like scleroderma or any illness, then try exercising a little more. Take warm baths, take warm showers, run your hands under cold water. Eat a little bit of more fat. Sometimes in real cold weather, sometimes when it's very, very cold, I take a teaspoon to a tablespoon of oil. It warms me up immediately because my body accelerates my metabolism. My body has to work harder and it makes me warm.
Beautiful. Thank you, Fred. Good words of wisdom here. Another question here from Donna on Facebook. She says, hey, Fred, does your pH change when you're taking blood thinners?
I never really thought about that, to be honest with you. And if you're on blood thinners, that's a question you should ask your doctor. But just thinking about it, off the top of my head, I would say no. Your body controls its chemistry. Your pH is supposed to be in a pretty narrow range, someplace between 7.35 and 7.45. Your body, through homeostasis, creates that range. There are many people eating totally different diets, and through homeostasis, your body tries to keep your pH between 7.35 and your blood pH, I'm talking about now, between 7.35 and 7.45. So in general, whatever substances contributed to this equation of getting you into the normal range, I don't think that blood thinners are going to take you change your everything else equivalent. I don't think it's going to change your pH, your blood pH. It might not change it at all. If it does, it's a very, very small amount. But that's a question you should ask your physician.
Great. Thank you very much, Fred. And don't forget to check out all our other vlogs, our survey, and our natural health plan on www.fredbisciforhealth.com.